to CBEC Cinta Baca English Club. So thank you for coming today. We are so glad that you're be able to be here with us right now, even though like right now is online, yeah. But it's all right though. How are you guys? Are you okay right now? How do you feel? Great, yeah.
Good, Phil.
I feel good.
Okay, great. Okay, so as you guys know, today's theme is about coronavirus, and as we know, coronavirus these days, coronavirus is like something that is really serious, and it's really important for us to know about coronavirus. It's not a something that you can just uh, avoid it. I mean, you can prevent it, but you have to try your best. This is not something that is like easy to cure if you affected by it, and then you just like, oh yeah, I will just get like go to the uh apotheke, right? Or maybe you will go to the pharmacy, will get medicine, and then that's it. You will be fine like a flu. No, it will be not like that. So for today, before I continue the CVEC, so let me introduce myself. My name is Benedictus Daniswara. You can call me Dennis. Yeah, and I'm a teacher in Cinta Baca. At Cinta Baca, I'm a BIPA teacher, Bahasa Indonesia untuk penutur asing teacher. So it's been a while. I'm working at Cinta Baca. It's nice and it's great to be here. And okay, so without further ado, let's start. And I wanna tell you guys about the update on coronavirus disease in Indonesia. So this based on WHO. So it says that as of 22 February 2021, the government of the Republic of Indonesia has reported about more than 1,200,000 people with confirmed coronavirus 19. There have been more than 30,000 deaths related to COVID-19 reported, and more than 1 million patients have recovered from the disease. So these things is really, really dangerous, these things. Like, this is not like a thing that you can avoid it very easily. You have to try to prevent it before you avoiding it, right? So we have to stay healthy. We have to, keep our distance and always wear masks. That is the important thing. Okay, so everyone here, I have a question for you guys. Do you guys know, does any one of you know about Cinta Baca? Is it your first time knowing about Cinta Baca? Does anyone? Okay. So some of you guys, are nodding. Yeah. So it means that some of you, this is your first time know about Cinta Baca. Okay. So I think we will introduce it to you about Cinta Baca. There will be like a video about Cinta Baca for a while, so you guys can see it. Okay. So let's check it out. The video. All right. Okay. Thank you for the video. So that is about Cinta Baca. If you want to know, you can visit the Instagram, Cinta Baca's Instagram, or maybe you can visit the website. Everything you want to know about Cinta Baca, they will be there. Okay. So without further ado, now we have a special guest. Okay, our special guest is Miss Christy. Welcome, Miss Christy. Hello.
Hello, everybody.
How are you, Miss Christy?
I'm good, thank you.
Okay, so shall we start, Miss Christy?
I'll just my screen.
Okay, cool. Okay, so before we start, I will tell you a little bit about Miss Christy. So Miss Christy is from New Zealand, and currently she is a nurse at the clinic. Yeah, at the clinic in New Zealand. So this coronavirus is very important for us. So I think like she's the right person to explain about it. Okay. Okay, Miss Kissy, can we start now?
Yep. Yes,
Cool.
let's start. Okay. Oh. Sorry, just a moment. Try again. All right. So as Dennis said, we're going to talk about COVID-19 today. Some of this you may already know. Some information might be new. If you don't understand a word that you see on the screen, please ask. It is okay to interrupt me. If you can't understand, just say, Christy, what does virus mean? Or the word you don't understand, you can ask me. Sometimes I speak very fast. If I talk too fast for you to understand, please just say, slow down, Christy. All right, so let's start with what is COVID-19. It's a virus, and it's a virus in the coronavirus family. There have been other coronaviruses in the world in recent years. SARS is one of them. That stands for Sudden Acute Respiratory Syndrome. And MERS is another coronavirus, Middle Eastern Respiratory Syndrome. You might remember SARS was in China a few years ago. COVID-19 is a new virus. It was first seen in humans in Wuhan in China in December 2019. They don't know, scientists don't know exactly where the virus first came from, but they think that it was from a traditional market, that the market was the center of the outbreak, but they are still not sure exactly where it came from. COVID can cause a range of symptoms. Some people just get very mild illness. So some people don't get very sick at all. Some people don't have any symptoms and don't feel sick. They might just lose their sense of smell. But other people get very severe illness, severe respiratory. So respiratory is lung, to do with the lungs. So some people get very serious lung disease and can die. So what are the symptoms of COVID-19? A cough. Now that might be a new cough or a cough you've had for a little while, but now it's getting worse. You might have a runny nose, or you might sneeze. Some people will have a very high temperature or high fever. Some people will lose their sense of smell. They can't smell anything anymore. Some people will get a sore throat. Some people will have all of these symptoms. Some will just have one or two. So how can you tell if you've just got a mild thing like a cold or a flu or COVID? How can you tell? Well, you can't tell without having a test. That's because some people think they have a cold and then they get a test and discover it's COVID. There are different tests available in different countries. In New Zealand, we use a PCR test that goes down your nose, down to your throat. Some of the tests are more accurate than others. And some tests have a high rate of false negative. Now, a false negative means that you have a coronavirus test and the result is negative, but you actually have coronavirus. So it is wrong. That's what we call a false negative. That's why it's really important for everybody to follow the prevention measures. Even if you've had a negative COVID test, it's very important that you do your bit to help prevent the spread of COVID. So how can we prevent COVID? If you are sick, you should stay home. If you go out, maybe you go to the market or you go to school or to work, you can make everybody else sick as well. Another really important thing to do is to wash your hands. And I'm just going to stop screen sharing for a moment to show you how to wash your hands in a good way. So to wash your hands, you get some soap on them. You rub your hands all together. You want to rub your palms together with your fingers locking, and then the back of your hand, the back of your other hand, round your thumbs, and then under your fingernails. And you want to do that for 20 seconds. Then you rinse it off in water. That's the proper way to wash your hands. If you were to study nursing, you would spend a whole day learning how to wash your hands properly because it's so important. Let's go back to the PowerPoint. Oh, actually, before we do that, the other thing I wanted to show you is if you can't wash your hands, you probably have hand sanitizer. With the hand sanitizer, it's the same. You want to do it like your hands. And you want to keep rubbing until all that sanitizer has gone and your hands are dry. If you touch something when the sanitizer is still wet, you can pass the virus on. Your hands have to be dry to kill the virus. We'll just go back to the PowerPoint. So the reason why it's so important to wash your hands and to wash your hands often is because washing your hands kills a little protective bubble around the virus. Without that bubble protecting it, the virus will die. So when should you wash your hands? You should wash your hands before you eat. You should wash your hands after you've been to the toilet. You should wash your hands before you touch your face or your nose or your mouth. And when you come home after being out, you should wash your hands. So you can't wash your hands too many times. It's very important. Now, this is very hard to do, but don't touch your face or your eyes or your nose or your mouth. Those are the parts of your face where the virus enters. If you have virus on your hands and you touch your eyes, you can get the virus. Or you touch your nose, it can go in through your nose or in through your mouth. It's very hard not to touch your face. Most of us touch our faces often during the day. So you have to think very hard. Don't touch your face. Don't touch your face. The other thing is, if you have a cough and you have the virus, you can spread the virus out to everybody around you. So when you cough into your elbow like this. So if you cough into the inside of your elbow, it's harder to spread. If you cough onto your hand, then you put your hand on the computer, on the table, you will spread the virus. Because you touch, the virus is on your hands from coughing. If it goes on the table, you can leave the virus on the table, and then someone else comes along and touches the table and they catch the virus. The virus can live on a surface or a door handle for days, so it's important to clean regularly all the surfaces that people touch regularly. So tables, the bench at home, door handle, clean it with disinfectant and clean it regularly. So if there is any virus there, you will kill it. Social distancing, that is a new phrase in English, social distancing. It's a new phrase from COVID. It means staying away from other people, at least 1 meter away. The closer we are to other people, the more virus can spread to us from talking or laughing. So the further away we can stay, it's better. Try to avoid crowded places. If you can't social distance, then you should wear a mask. We're going to play a video about sharing a mask. Cheetah, can you play the video, please?
A fabric mask acts as a barrier to prevent the spread of the virus. It must be used correctly and always combined with other measures to protect yourself and everyone else. When wearing a fabric mask, clean your hands before putting it on. Inspect the mask and do not use it if it is damaged or dirty. Cover your mouth, nose, and chin. Adjust the mask to your face, leaving no gaps on the sides. Avoid touching the mask while wearing it. Change your mask once it gets dirty or wet. To take off the mask, clean your hands first. Remove it by the straps behind the head or ears without touching the front of the mask. As you remove the mask, pull it away from your face. Clean your hands after taking off any mask. If you need to reuse a fabric mask, store it in a clean, resealable bag. Hold the mask at the elastic ends when removing it from the bag and make sure it is not dirty or wet before using it again. Wash fabric masks in soap or detergent, preferably with hot water, at least once a day. Make sure you have your own mask and do not share it with others. When wearing a mask, make sure you know how to put it on, use it, remove it, and discard it or wash it correctly. Remember that a mask alone cannot protect you. When wearing a mask, continue to adopt other measures to prevent the spread of the virus. Stay at least 1 meter away from others. Clean your hands frequently and thoroughly, and avoid touching your face and mask. Stay safe, and let's all prevent the spread of COVID-19.
Stay home and away from other people because you don't want them to get sick. and you need to rest. Your body needs rest to fight the virus and get better. Fluids, so that means drinking lots of water. We'll drink lots of drinks, but water is a good drink. If you get a fever, you can get dehydrated. That means your body doesn't have enough water to function properly. So if you are sweating a lot, you sweat a lot in Indonesia because it's hot, but if you have a fever and you are sweating more, you need to replace the salt and the sugar in your body that you've sweated out. The salt and sugar is called electrolytes, and it's important to replace that if you have a high fever and are sweating a lot. In Indonesia, Pocari Sweat is a good drink to help replace electrolytes. Also, green coconut juice, so kelapa muda, is good as well. So they are good drinks to drink along with lots of water if you get sick. It is important to eat healthy food. Your body needs the nutrients, so the good things in fruit and vegetables to help you get better. For healthy food, at least half of your plate should be vegetables, just a little portion of rice and a little bit of meat, and the rest should be vegetables. Vegetables and fruit are very important to help you get better and get strong. If you have pain, some people with COVID get body aches and pains. You can have paracetamol to help with the pain. If you have COVID and you have difficulty breathing, you should go to hospital. That's really important. People who have difficulty breathing with COVID are the ones that get very sick. So it's important to go to the hospital as soon as you start to feel in your chest that it's hard to breathe. Now, some of you live in areas where there is a lot of dengue or demam berdarah or malaria. So if you have a fever, it's important to see your doctor and check whether you have dengue or malaria or COVID, or maybe just a fever with a cold. Okay. Now, is there any questions? Don't be shy.
Okay, so if anyone has a question or wants to ask about coronavirus? Okay, before we continue, I want to ask to Miss Christy. So, I mean, like our video has, has a problem, yeah, trouble. And can we replay it again? Is it okay?
Yeah.
Okay. Chita, are you ready?
The video before?
Yes.
Okay, okay.
Yes, the video, it was cut in the middle of the video. So.
The virus. It must be used correctly and always combined with other measures to protect yourself and everyone else. When wearing a fabric mask, clean your hands before putting it on. Inspect the mask and do not use it if it is damaged or dirty. Cover your mouth, nose and chin. Adjust the mask to your face, leaving no gaps on the sides. Avoid touching the mask while wearing it. Change your mask once it gets dirty or wet. To take off the mask, clean your hands first. Remove it by the straps behind the head or ears without touching the front of the mask. As you remove the mask, pull it away from your face. Clean your hands after taking off any mask. If you need to reuse a fabric mask, store it in a clean, resealable bag. Hold the mask at the elastic ends when removing it from the bag and make sure it is not dirty or wet before using it again. Wash fabric masks in soap or detergent, preferably with hot water, at least once a day. Make sure you have your own mask and do not share it with others. When wearing a mask, make sure you know how to put it on, use it, remove it, and discard it or wash it correctly. Remember that a mask alone cannot protect you. When wearing a mask, continue to adopt other measures to prevent the spread of the virus. Stay at least 1 meter away from others. Clean your hands frequently and thoroughly, and avoid touching your face and mask. Stay safe, and let's all prevent the spread of COVID-19.
Okay, so that was the video from WHO. That was a great video. Okay. Welcome. Yeah, if you new here, it's okay. It's great. So right now it's a Q&A time. So does any one of you have a question about this COVID-19? Okay. So if there is no question, maybe like I will ask first to Miss Christy. Okay, so Miss Christy, about this. So it says that, you know, like if we, I mean, like the symptoms of COVID-19 is, you know, like fever, feeling dizzy, have body ache. So, I mean, how do we know if this one is COVID-19 or not?
You don't know unless you have a COVID test. It's the only way you can tell. Because sometimes COVID, this looks like another illness. So we don't know unless you have a COVID test.
Okay, that's good. Anyone else?
I have some question, Miss Christy. My name is Clara. If I have a friend or if someone or a patient who complete quarantine, is it safe for me next to her or him or share fruits one each other? Is it safe? And the second,
Sorry, if they've
yeah,
if they've completed quarantine,
yeah.
is that the question?
If someone or a patient who completes self-quarantine, is it safe for me next to her or him or share my foods one each other?
Yeah. If they no longer have symptoms, if they are better, then it is safe. It's usually this is difficult to say to an Indonesian because it's a much more sharing culture, but it's not a good idea to share food. Use your own bowl and your own spoon or fork. If you share the same bowl or the same spoon or fork, you can share disease, not just COVID, but meningitis and other serious diseases.
Okay, thank you. And the second, what's the common effect after someone or a patient goes through COVID-19 treatment?
Yeah, some people get better from COVID and are normal again. Some people can be sick for a very long time. In some countries, they are reporting people feel very tired for months afterwards. They forget a lot of things. Some people have lung damage and they still have difficulty breathing. months later. I think COVID is such a new disease. We are still learning a lot about it.
Mhm. Okay. Yeah. Thank you, Miss Christy.
You're welcome.
Okay, sorry. Okay, that was a great question and a great answer. Does anyone want to ask something? Does anyone has a question? Okay, great.
Okay. I want to asking to Christy about Max. Do you tell about a fabric Max on video? But I want to asking about medis or disposable Max. We know so many people using that. Not real, not everyone using a fabric Max because they feeling not feel safe if they're not using a medis or disposable Max. So I want to asking actually how to what I want to say. The fabric max you can use it after you wash it, but how about a medis or disposable max? You must to wrap, or I don't know how to uh, uh, buang trash it. I don't know how to trace it because we can just trust like that. Am I right? Maybe you can explain to us about that because I think a lot of us here using medis or disposable max. Thank you, Christy.
Yes. Yes, you can use the medical mask, the paper mask. If it gets wet or dirty, you need to change it and throw it away. You should only use it for one day and then have a new one the next day. Here in New Zealand, that is why many people are making or buying fabric masks, because you can wash it and then use it again. So it is cheaper in the long run to have a fabric mask because you can use it again. But the medical mask you must throw away after one use or when it gets wet.
Okay, Christy, thank you. So we need to tear off that max before we press it, right? Christy?
Sorry, say that again.
So we must tear off the max before we press it, right?
Yes, you take it off the same. This is a cloth one, but if it was a medical one, it's the same. You take it off by the ear straps and then throw it in the rubbish.
Oh, okay. I mean, we need to tear off. Sorry, the tear off. I don't know. Am I right?
Take off.
Tear off.
Take off.
Tear off.
Oh no, you don't want to touch it.
Oh, you don't need to tear off.
If you touch the mask, yeah.
Oh, just like
the
that.
mask is dirty. If you tear it, you will get virus on your hands maybe. So just take it off by the ear straps and throw it in the rubbish bin.
So I ever hear it from social media because when we after using medis marks, we need to tear off before we trust it. So I want to make sure that it's okay or not about that.
Yeah, it's better just not to tear it, to throw it straight out. If you tear it, you are touching the mask where it's dirty. Yeah.
Okay, thank you, Christy.
You're welcome.
We have a
Okay, we have another question from the chat. Okay, I will read the question, Miss Christy. So the first one is from Titin. Okay, hello Titin. Okay, It says, I do ever read that this pandemic could run still for 3 or 4 years ahead. What do you think? And what about the vaccine that already spread to all the country this day? So that was the question.
Yeah, thank you, Tishan. Good question. I really hope the pandemic doesn't go for another 3 or 4 years. I think it will go for some time yet. Sometimes you hear people say nobody is safe until everybody is safe. That means until we've got rid of COVID in every country of the world, we will still have a pandemic. And the vaccine is helping with that. Many countries, I think Indonesia already has the vaccine started. Many countries now have a vaccine. England in particular has vaccinated millions of people. And for the first time since the pandemic started, their COVID numbers, case numbers are going down and the number of deaths is dropping. So the vaccine is really important to stopping COVID. There are many different vaccines and different countries are using different vaccines. But a vaccine helps your body to recognize. The way a vaccine works is it shows your body what the virus might look like, and your body develops something called antibodies, and that's in our immune system, and that helps you fight the virus. So if you've had the vaccine, you can still get COVID, but you won't get as sick as someone who hasn't had the vaccine. I'll give you an example. Say Dennis has the vaccine. I don't have the vaccine. Together we meet our friend. Our friend has COVID and we both get sick. I will probably get very sick because I have had no vaccine. Dennis might just be a little bit sick because his body is better protected from the vaccine. In New Zealand, we just got our first vaccine this week, and we started giving the vaccine to all the border workers. When you come to New Zealand from overseas, you have to go into hotel quarantine for 2 weeks. So all the people that work at the hotel quarantine and at the airport now have the vaccine. They got it first because that will protect the rest of us while we wait to get enough vaccine supply to do everybody else. I hope that answered your question.
Okay. All right, Miss Christy. There is another question. So this one is from Mularia. Hello, Mularia. Okay, so it says, I'm Mularia Sarito. I have a question. How do I keep my distance while riding a train? What I see, I think this one is from what I see, there is no distance at all that is applied. Say so.
Hi, Mularia. Okay. That's a very good question. You can't social distance on the trains, too many people. But it's very important that you wear the mask on the train. And if you can get a little container of hand sanitizer and keep it in your bag, when you get off, use the hand sanitizer, because lots of people touch all over the train. So the best you can do is wear a mask and use hand sanitizer. It is very difficult on the train. In New Zealand, we don't have any COVID. We've got 9 cases in the whole country, and they are all in quarantine now. But because you can't keep distance from people on the train and on the bus. In New Zealand, it is compulsory. Everybody must wear a mask on the train because we are worried if we get COVID back in New Zealand that it will spread on the train and the bus. You're right, that's a big place of risk is on the train.
Yeah, maybe if I wanted to ask him, Christy, is maybe it's not it's difficult for us to social distancing, but if we need hand sanitizer everywhere, right?
I think it's a good idea. Yeah.
Yeah, because in train,
I
Indonesian
carry a
trains,
little,
sorry, please.
even in New Zealand, I carry hand sanitizer in my bag with me everywhere. Yeah.
Okay, is that it? Okay, so we got another question. Ooh. So this one, oh yeah, how about Mularia? Is it answered? I mean, like it was answered the question, yeah? Okay, yeah. Okay. So next one is from, sorry. Okay, next one is from Rasiva Nadila, yeah, Rasiva Nadila. Okay, it says that when is the perfect time to have COVID test and avoid false negative? Is it matter of the time or the type of test which cause the false negative? Thank you.
Yeah, that's a good question. And it's a hard question to answer. I don't know that there is a perfect time. If you have symptoms, you should always get a test. I'm not sure what tests you're using in Indonesia. In New Zealand, we had 2 different kinds of PCR swab, and they've decided that one is more accurate than the other. So we are using that one. Yeah, it's tricky. If you've been in contact with someone but don't have symptoms, I think they have recommended testing days. But if you are sick with symptoms, I don't know if there is a perfect time. I think, yeah, I think the PCR test is the most accurate one, as far as I know, but they are still, the scientists are still learning. I know some countries are doing saliva, so with spit testing. We don't do that in New Zealand yet because the government wants to find out more about the science. We don't do blood tests in New Zealand for COVID yet either. We just do the PCR swab. I'm not sure what tests you have there. Maybe somebody else can answer what tests you have available in Indonesia.
In Indonesia, the test for okay, hello, there suaraku kedengaran nggak sih?
No.
Maybe Dennis can answer. I don't know.
Rasida's answered.
Okay, so okay, this one is another question from Laili, yeah? From Laili. It says, hi Miss Christine, I'm Laili and I have a question. When will everybody can perfectly build a new immune system so the COVID-19 no more be a dangerous disease in the world?
Yeah, thank you. I just see that Rasiva's answered a question about the tests. You have PCR swab antigen, and the rapid test. So you have many kinds there. I'm not sure of those which is the most accurate. I don't know whether your COVID website has answers to that. There's a website, covid19.go.id. I'll put that in the chat if I can. That's the Indonesian COVID website. Oh, sorry, I've forgotten what it was. 19.go. I think that's the website. They might have information about the tests there. And back to Lily's question, you're right. When everybody's immune system has immunity to COVID-19, it won't be so dangerous anymore. It might be like influenza. 100 years ago, there was a Spanish influenza pandemic and many people in the world died. Now we have influenza vaccines. Influenza still causes people to die, but in not the same numbers that it used to, partly because we have a vaccine for it now. So you're right, when everybody has immunity, and that will mean probably everybody in the world having a vaccine. We're not sure with COVID-19. Sometimes some diseases like measles or chickenpox, once you've had the disease, you have immunity, you can't get it again. Now, COVID, we think, is different. Some people have been reported to have COVID 2 times. So to get the immunity, you need the vaccine. So that's what I was saying before. Nobody is safe until everybody is safe. That means once everybody in the world has had a vaccine, COVID-19 won't be the same problem that it is today.
Okay, thank you, Miss Christy, for the answer. Okay, does anyone have any question? Maybe you can just ask.
Hello, Miss Christy.
Hi.
Hi, can I ask something? Is there any stigma in the New Zealand for the COVID patients? Because here in Indonesia, if somebody get diagnosed as COVID, it's usually is a despicable or like a bad disease. The stigma is very bad in here.
That is sad to hear that, but I think people all around the world are the same. I think that's happening in other countries too. It is sad because you can't help it if you get COVID. Even if you do all the right things, you wear your mask, you wash your hands, you stay home if you're sick, you can't control other people's behavior. You still might get sick and it's not your fault. In New Zealand, I think the stigma is not so bad because our Prime Minister said right from the start, we have to be kind. So the slogan in New Zealand this last year has been be kind. Our Prime Minister, every day she was getting up to speak to the media and the TV, and she would say how many new cases at the start of the pandemic, and she would say, remember, be kind. So I think she has really helped people think, oh, I must be kind. If my friend has COVID, I need to look after her. I need to keep myself safe, but I need to look after my friend. But I think, unfortunately, there has been some stigma. Some of the people, some of the nurses and other staff who work in the COVID quarantine hotels, they have had some stigma. Some of them haven't been allowed to go home. to their, we call it a flat, maybe a bit like a COS. Sometimes the nurse came to go home and the people in their COS said, no, I can't come home, you might bring. So there has been some stigma here too. Like I said, people are the same everywhere in the world.
Okay. Okay, I think this is the end of our Q&A session. Okay, I think right now is taking picture, yeah? We take pictures together. So maybe all of you can turn on your camera so we can take a picture together with Miss Christy.
Okay, everyone, turn off your video so we can. We just have to. Okay, there's anyone ready for take a photo? Okay. Okay, there's a 2 slide here. So when we don't know you're in one or slide 1 or slide 2, but we need to get get a style to take a picture after I say that. Then it's okay. Okay, let's take a picture. Okay, okay, let's give your style. 1, 2, this is slide 1. 1, 2, 3. Okay, masih ada yang belum, there's still not open that video. Okay, slide 2 is still, hold on. Okay, wait. There's a, once again, sorry, still there's no people here with hair. Sorry, wait a minute. Okay, it's a wrap. Thank you so much.
Okay.
Thank you to Dennis again.
Yeah, thank you so much for everyone who joined our CBEC. So see you next month, yeah, 24th March 24th, 2021. So the speaker will be Mr. Isaac. So he is from United States of America. If you know him, I think some of you knew him, yeah, because he was a speaker. And Cinta Baca English Club. So I think this is the wrap. Okay, see you next month, everyone. Thank you so much for joining. Bye, and then thank you so much, Miss Christy.
Thank you, Miss Christy. Rainbow Clavers.
Thank you, Denny. You can unmute your.
Thank you, guys.
You can unmute your mic. Thank you, everyone. Terima kasih, Mularia Sarito. This is my sister. Thank you. Thank you. Thank you, Sister Titin. Thank you, Marina. Thank you.
Bye, everyone.
Thank you.
Bye. Thank you. Thank you.
Thank you, Marina. See you next month. Thank you, Mularia. See you next month, Mularia. Thank you.